Hi, hello, and welcome to Malini's Health Talk. There has been quite a number of questions by mails, and most of them were actually sent to me via direct messages and private messages. And I realized when I read these messages, it's like when women, we freely talk about our skincare, what helps and what doesn't. And by seeing these messages that were sent to me privately and they requesting that I do not use their names on the show, made me wonder how easily or readily are these men willing to come up and get help for skincare, right? So, but anyways, we will start with these questions. I have one person who said it's okay for me to use his name. His name is Praveen Kastri, and he wants to know, how do you prevent razor burns after shaving?
He's probably his shaver, I think, or right? Otherwise, how do you get the burns? The other thing is, so it's a shaver, and then you could get a shaving foam that is, moisturizing enough so that you don't, so it slides and it does not cause friction as you shave. I mean, that's my solution.
Right. Okay. And another question was from another gentleman who wants to know what's the reason that he's getting skin tags on his face, and how do you remove it and prevent it from coming back?
Okay, skin tags is runs in families, and especially Indians tend to have this predisposition to skin tags. It's genetic. So removal is, we do lasers because they always have got like a stamp, and so we burn it off, and then normally it's all gone. Sometimes they may leave a mark after post laser, and then we take off the mark with chemical peels, so then it's gone, it's all gone. So normally a lot of people come after collection of skin tags on the neck and the face. Now, prevention, you will get new skin tags because it's genetic, you get others coming. Now, I always say exfoliate, because the skin tag is like a growth on the skin. If you keep exfoliating your skin, like with scrubs and or using retinol, it may prevent it from coming up. You can reduce the number. That's the only thing. But if they do come out, then you just come and laser it.
The next gentleman says he's in his 40s and his eyebrows are thinning. He wants to know what can be done about that.
There must be a reason why your eyebrows are thinning. So, you need to check out your thyroid hormone, because when you have low thyroxine, usually the lateral eyebrow, even for men and women, they drop. So you need to do that, because so check that out. And if it's nothing wrong, and maybe through aging, there is we use a thing called Revitalash, which is uses growth peptide. So they have Revita Brow, which you could apply over the brow, and the hair will grow back.
Okay, this is a more intense question by a gentleman. He has said that he's been living with this problem for the past 12 years. He has got a dark patch that comes out from the temples and extends to my cheeks, to his cheeks. Yep. So he wants to know, what is this condition and how can it be helped? He has had this condition for 12 years and he has seen a few doctors and there's been no help.
Okay, so it's 12 years. I don't know his age. There's two. So if it was much earlier, then it could be lichen planus pigmentosa, which is, it happens usually with Indians. Mm-hmm. Why? No one knows. Sometimes the aggravating factor that can occur, like a hair dye or some irritation or very bad sunburn, could bring it on. The other scenario in a much older person is melasma, which also is like what women have, is hormonal and sun, and it also occurs in men also. So usually they have a patch, really dark patch here and down the side of the cheeks. Now the treatment is it's difficult in that you have to see someone like myself who's specialized in treating pigmentary disorders, hyperpigmentation. So in my clinic, normally I do a chemical peel. Usually it's the Obagi blue pill, which is the one that works with melasma very well. So it's many sessions, gradually, taking off layer by layer, and then you apply lightening cream and strict sun protection cream, and usually gradually you get to lighten the skin. And it might take 5 sessions more before you get to the ideal tone.
And this is about hair care. Quite a lot of questions are coming about hair care as well. How do you control it? Is there any hair care regimen that they can follow?
Okay, so the hair loss depends on the age, right? A lot of it is also from stress. So, and okay, now this is why this is a very important message. Anyone with hair loss needs to see a doctor, not go to any of these beauticians or these hair places, because there is also a lot of them with underlying hormonal issues. Okay, so these are the medical conditions that can cause hair loss: anemia, hypothyroidism, imbalance in the sex hormones, so polycystic ovarian syndrome. And then there is also some women who have got higher than normal testosterone. Then there's a genetic flaw where you have got higher sensitivity to testosterone, which is then called the female pattern baldness, which is similar to what men suffer from. So when you come, we do normally a blood test. We'll check out the iron and as well as the hormones, and then we have a good idea as to what you need. So if it's hormonal, you like thyroid needs to be corrected. If it's anemia, you need to take iron medication. Then to grow the hair back, there are two stages. One, you stop the hair from dropping. Now, if it's just nutritional or hormonal like that, they correct it, the hair will be fine. It will stop after about a month to 2 months. Then second phase is growth. Now, growth is even harder. And that's where we give hair growth, specific hair growth supplements, as well as stimulate the hair follicles with growth peptides to grow. And that can take another 3 months. So your hair growth, you only will see in 5 months' time from the day of treatment. And the other thing is with the women who are susceptible to testosterone, the treatment is ongoing for life. They actually have to use minoxidil for the rest of their life. They cannot stop. The hair will drop, and that's it. That's the story. That is why they really need to see a doctor and find out what is the cause and then address it.
A viewer who wants to know how can she treat dandruff in her teenage child?
Sometimes it could be fungal. It could also be sensitive skin to the shampoo. Some of the shampoos can be a bit harsh, and then they start drying up the scalp. When the scalp becomes too dry, then they have dandruff. So my suggestion is again, you need to see the doctor, because they need to find out, is it fungal or is it sensitivity? And by looking at the scalp and what's happening, that's the only way to know what's the treatment.
I'll just ask one more question. Kala Jessie wants to know, is there any vitamins that she can specifically take to reduce hair loss?
If you're talking about reducing hair loss, it again depends on the cause. Now, if it is male hormone, you can take zinc, may help, but not really. You need all the things. Now, I think it's to regrow hair. If you're going to want to grow hair, then it's biotin, 10,000 microgram. That's what I recommend. A whole lot of the vitamin Bs, and and I make sure you don't anemic, then iron. So these are the things. But biotin is the main thing. See, this is why you need to get a hair loss formula, because they have a whole lot of things in that: zinc, selenium, some of the Bs in it. It's a combi. So it's better to get those supplements than trying to eat all the different products that you need for your hair.
Right. Okay. There's still a lot of questions, but because we're running short of time, maybe we'll have one more session with you maybe sometime next month. Can I come with you on that one?
Sure. You collect all your questions. No problem. And then Hema, the other thing is a lot of the questions, a lot of the info is on the website. So if they go in the website, I've updated the website. There's some info like hair loss, skin tag, and everything is there. So they can, and dark circles, it's all there.
So that was Dr. Komathy, and she had very patiently answered all our questions. Not all, actually, most of our questions. There is some that's still pending, but because we're running short of time, we will take it on another session with her. And as I said, if you want to avail her services or you want to have a consultation with her, the name of her clinic is Lifestyle Clinic. I will also have the address and telephone number in the description box. You can have a look at it, and if you have got more questions, you can post your questions in my description box, or you can contact her directly. Thank you so much for watching, and it's been Health Talk with Malini. Bye-bye.